Welcome back into LX News Now, everybody. Now, what was supposed to be a routine screening ended up saving the life of NFL Hall of Famer and one of my favorite sports guys on the TV, Shannon Sharpe.
Yeah, Shannon recently revealed he was diagnosed with prostate cancer back in 2016, something he kept private for years, but now he's sharing his story to encourage others to get tested.
I started getting screened in my mid-30s, although they recommend in your early 40s, mid to early 40s.
Wow.
But because my dad died at 39 from cancer. He had a brother die in his 40s, another brother that barely made it to 50. So I felt that I needed to get screened early. So once I retired from football, I retired about 2 weeks before my 36th birthday, I started getting screened because I knew the likelihood I was in a high percentile of developing some sort of cancer. And so it possibly saved my life.
And to be clear, you're cancer-free right now.
I am cancer-free right now.
Family history, super important here. Now, the timing of the story also very important because September is Prostate Cancer Awareness Month. Data from the CDC shows out of every 100 American men, about 13 will get prostate cancer in their lifetime, and about 2 to 3 men will die from the disease.
But black men are more likely to get prostate cancer. So here are some actual warning signs you need to look out for. This all according to the CDC. We're going to put them up here and make it easy for you. That includes hip, back, or even pelvis pain, blood in your urine, and loss of your bladder control. Ashley?
So here to educate us about prostate cancer is Dr. Benjamin Garmezy. He's the Assistant Director of Genitourinary Research at the Sarah Cannon Research Institute at Tennessee Oncology. Dr. Garmezy, we're going to play a bit of a game with you. It's myth versus reality to kind of make these facts really jump for people so they remember it. I'm going to read you a few myths about prostate cancer, and you're going to give us the reality of that statement, if that's okay with you.
That sounds great. Thanks.
Okay, awesome. So let's start with the first one, that prostate cancer only affects older men.
Well, that is a myth. So age is the most important factor for developing prostate cancer, and it is more common as you age. But men at younger ages can still develop prostate cancer, and unfortunately, it's all too common. In fact, we recommend screening starting at 50 for most men, and all the way down to 45 or 40 for higher at-risk groups, such as black men or African-American men, as well as men with a strong family history of prostate cancer.
Right. Okay, here's another one that's interesting. Prostate cancer is not associated with other cancers.
That is also a myth. So unfortunately, there are some genetic predispositions that we can inherit at birth to develop prostate cancer. One that is common that some folks may be familiar with is the BRCA gene. It's linked to breast cancer and ovarian cancer. But in men, it's also linked to prostate cancer, as well as other cancers such as pancreatic and the skin cancer melanoma. So if you have family history that is strong of those conditions as well, there is a slight chance that you might have one of those risk genetic predispositions.
Yeah. Okay, and you just did 2 birds, 1 stone, but because we have it, I want to make sure people understand it. My next myth was going to be that prostate cancer is only hereditary.
So yes, this is a myth. Most men with prostate cancer developed it without a hereditary predisposition, but there are some men that do have that genetic link, but that is less common.
Yeah. Okay, but here's a common myth that I actually have heard. If I feel fine, that means I do not have any symptoms of prostate cancer.
Yes, well, that is both maybe a myth and a reality. So you can develop prostate cancer and never know you have it. In fact, prostate cancer is all too common. About 250,000 people this year in America alone will develop prostate cancer, and about 1 in 8 men will be diagnosed at some point in their life. Now, some of those men will have symptoms, such as urinary symptoms or pain, fatigue, unexplained weight loss, but other men may not have symptoms. Now, the reason why I say it's complicated is because you still may be fine even if you develop prostate cancer. Most men with prostate cancer won't actually die from their disease. They just need to be monitored more closely, and some of them don't even require treatment.
Right. Okay, that's good news. I wasn't expecting a light in this tunnel, so I appreciate that. Okay, let's do one more. This one says the PSA test, and that stands for prostate-specific antigen test. It only looks for cancer.
Yes, this is also a myth. So PSA, or prostate-specific, is not always prostate-specific is what I meant to say, though most of the times when PSA is elevated is because there is a disease in the prostate. Now, sometimes that's a benign condition, as we in prostates enlarge as men age, and that can be enough to raise the PSA. But other times, infections, any kind of inflammation of the prostate can do it. So generally, if your PSA is elevated, that's not always a sign that you have prostate cancer. It just is a sign that the prostate gland is changing, and whether that's an acute change that could resolve, such as an infection, or a chronic change, something that will continue to develop over time, such as a benign growth of the prostate, that doesn't always mean you have cancer.
Now, doctor, I know that we just went through, myths that we were able to research, but I wonder, when you talk to patients, what would you say is the #1 misconception you hear that you can clear up for our viewers as well?
I think the #1 misconception is the one that most men fear. It's that they have a lethal disease and that they're going to die of their prostate cancer. Cancer is such a charged word. It's so scary. The media, movies, every time we think of cancer, we think of people with IV bags getting chemotherapy and losing their hair. In fact, most men, as I mentioned earlier, will not die of their prostate cancer. Most prostate is what we call cancer, is what we call a non-lethal disease. And most men who come into the office of a medical oncologist or a urologist will actually not necessarily even need any treatment, just screening and monitoring, so that if something does change, that an intervention can be done prior to the prostate cancer becoming a more lethal condition.
Well, Dr. Benjamin Garmezy, I want to thank you so much for coming here, being willing to have such an important conversation with me for our viewers. Thank you for your time.
Great. Thank you for having me today.
Absolutely.